Oh, shi enda chini bwana. Chini bwana. Teremka kwanza. This way? This way? Could you have the other side?
Today, it gives me great pleasure to witness the delivery and rigging of the cyclotron machine at this hospital. This is the machine that produces the radioisotopes that are used as a tracer for cancer patients. The radioisotopes are also used to monitor the remission or progression of cancer on the patient. The cyclotron machine comes with radiopharmacy equipment, hot labs, that are used to sensitize the radioisotopes to make them ready for patient administration in terms of dosage and safety. Let me take this very early opportunity to thank the board of directors and management for taking this bold step. This cyclotron will be the first public facility and the largest in Eastern and Central Africa, with the capacity to produce consumables for domestic use and for the region. And for that, we are very, very happy and very, very grateful that it has all been accomplished. And I want to say once again, a big congratulations to the chair, the board, and members of the management who have managed to get it done. But in addition, a 256 slice CT scanner and a 3T MRI have been delivered, installed, and user training undertaken. I'm informed that the equipment is currently in use at the imaging department. Again, congratulations, well done. Fellow Kenyans, our people spend about 8 billion Kenya shillings annually seeking cancer treatment in India, South Africa, and Dubai. There is a growing interest from the government and private healthcare providers, as well as public sector, in cancer management. And we have heard the previous speakers, both the chair and Brenda, talk about the seriousness of the disease in this country. And it is expected that the number of patients seeking and receiving quality care is expected to increase over the next 5 years. I'm glad to note that this hospital sees this as a huge opportunity to increase access to quality cancer care by addressing existing gaps and potential future growth through innovative care delivery models. Consequently, the hospital has sought the approval for the construction of the IMIC from the Kenya Nuclear Regulatory Authority and the Pharmacy and Poisons Board to establish the capacity we are witnessing. And we expect a license for operations to be issued by the two bodies. I'm also delighted to note that the construction progress for the Integrated Molecular Imaging Center, IMIC, is well on course. And the last time I was here, I think we were just talking about something that was down here, and the other one had not even started. So well done, and I want to say the contractor is doing a good job. I am informed that the IMIC has the following unique features: the capacity to produce PET CTs, radioisotopes for use locally and in the region, capacity to safely package and dispatch radioisotopes to other hospitals locally and in the region. And this is where the chair of the board is referring to the methods that we might want to apply to do that. May it be drones or any other means that we are going to apply. We also have the ability to comply with all regulatory requirements, a hub and spoke model with IMIC as the anchor establishment, supporting the PET-CT establishments in counties and other hospitals through the provision of radioisotopes and capacity building. A training center that will provide capacity building for staff running the PET-CTs at the hospitals, in counties, and in the entire region. The impact of this development will be felt far and wide. Today, patients are being diagnosed with stage 3 and 4 cancers due to inadequate diagnostic capacity for early detection. The center will have the clinical, financial, training, research, and socio-economic and environmental impact on Kenyans in the following areas: the early diagnosis and assessment of the response to treatment, meaning we shall be able to diagnose cancer before it's too late, as is currently the case. We will improve on the accuracy in diagnosis and treatment of cancer. We will reduce incurrent or metastasis of cancer. We will improve survivorship. We will reduce in waiting time and cost of cancer treatment. In addition, we will significantly reduce cancer-related mortality. We will also attract medical tourism from East, West, and Central Africa. In addition to all this, we will also conserve foreign exchange used by Kenyans who seek treatment abroad. Not to mention that we'll also support other cancer centers that invest in paired cities through the provision of consumables, FDGs, general support, and personnel training. As a medical tourism destination, I'm gratified to note that the hospital has put up a hospitality facility with enough bed capacity to cater for the caregivers of patients seeking treatment at this facility. This is as it should be. My only wish is that the board and management will ensure that the services offered here are better or equal to services that Kenyans seek abroad. My view is that we should beat the competition on two fronts, and the competition being India, Dubai, and the other ones. There are two fronts on which we can win other tourists who are medical tourists who are currently traveling to those countries. The first one is efficiency. Just efficiency. We have got the equipment now. We are training the personnel. Just efficiency, just being totally efficient in both clinical and non-clinical areas. I think the second one is the cost. I think we have to make sure that the cost of treatment of cancer in this country is equal to or less than that in India. And I think that is a formula which we should apply. If we apply the formula of equal to or less than India, I am sure we will be able to attract the regional market so that they can come here for treatment. And in so doing, they also assist our economy. So I want
this facility was supported by His Excellency the President through the Ministry of Health. And we started by, of course, floating the tender, international tender, which was awarded to GE. And the site was handed over to GE as a contractor on 24th of 2020. And I'm happy that the contractor has worked hard and is ensuring that the delivery of the project about 40 weeks to complete, and as I say, we are still on schedule. The equipment has been inspected by board members before they were delivered. This particular cyclotron was inspected in Sweden through our ambassador there and the experts that we hired there, because that time we couldn't travel because of COVID. But it was inspected and is starting to be what we ordered. So the cyclotron we are receiving today is part of the imaging equipment that this hospital is installing to ensure comprehensive cancer care. So we have set up a team that is working on the logistics to transport the consumables or the isotopes from this hospital to other facilities in the country. And the team is looking at several options, including the drones, the helicopters, and other options. Other equipment that has been received and are part of this project are the MRI machine, which is here already and in operation. The patients are already benefiting from this particular machine. It's the highest quality machine. We also have the CT scan machine, which is also installed and also in operation. The equipment we are inspecting soon, and we have just been from Dubai to inspect it with the GE team and our team here from the hospital. This is the PET CT scan and also the SPET CT. These machines are on the high seas. We expect them here in the country within the next 1 week or so. And these machines are, as I said, part of the project. We are also constructing the hospitality center, which you can see on the right. And this is informed by the need for accommodation when the patients and relatives come here in this facility. And the accommodation center has the capacity of 100 standard rooms. So in order to receive treatment from the IMIC facility, we are working on modalities of how patients can pre-register with us so that we can have efficient provision of the services. So we'll be announcing to Kenyans when this facility then will be operational, hopefully in the next 1 month or 2, so that we can have the registration start. So through the main contractor, we have engaged a company by the name Psychromedical, a US-based company, to run the facility for 18 months, within which time they will train our staff, who then will take over the operation of the project. And to ensure the facility is fully operational, we have hired the requisite staff to run the procedures